presentation, I need to give a little introduction to my earlier employers. Actually, now I am superintendent. Yet my association, emotional association continues. And Dabur India Limited actually must be, most of you are hearing about it. The company has taken it as a mission to deliver natural healthcare solutions to every household in the country. And then Rasayana, the concept which I remained their mainstay. It's a good company in terms of science and technology, and it's the largest manufacturer of Ayurvedic medicines and healthcare products in the world, with perhaps 13 or 14 units in India and 9 units in other countries as well. So, one of the important aspects of this company is, though they work on the classical Ayurvedic medicines, and Ayurveda itself is a very marketable concept actually. But despite that, they were interested to validate the concepts of Ayurveda and the products which they make, including the ingredients they use. They would always prefer to go for a scientific scrutiny, understand the inherent mechanisms of their healthcare benefits, etc., and to a possible extent, pass on this knowledge to the consumers about the benefits based upon the science. This is the kind of background. And to do this work, whatever I'm going to share with you, I was involved in the biomedical research between the years 1993 to 2000. From the year 2000, I was asked to do something else in the company. And almost this is whatever work I'm going to share with you is about 20 years of work. Therefore, I'm naturally anxious whether I'll be able to recollect everything and then share with you adequately or not. What I would like to do is, my objective is, I wanted to talk to you about a brilliant concept of Ayurveda, the Rasayana therapy, or Rasayana Chikitsa, and the Rasayana formulations and the medicinal plants identified for the purpose of Rasayana. This is first part. The second part is I would like to illustrate the brilliance of this Rasayana concept using a modern scientific investigations. What I will do is, I will do the reverse. First of all, I will narrate four case studies of scientific research on the Rasayana herbs and the formulations, not largely solely conducted by Dabur, and then followed by the explanation of the inherent mechanisms related to this. This is the first slide I would like to show. It is understood phenomena that all the living beings are surrounded by a bioenergetic field. This bioenergetic field, we call them, because bioenergy, continuously all the living organisms emanate some degree of radiation. And this radiation is not visible to the naked eye, neither it can be photographed by an ordinary camera. So therefore, they use the technology called a Kirlian camera. The Kirlian camera would not take your image, but it would take the entire image of the aura emanated by the living organism. So here I am showing but taking an aura is simple. Taking a photograph out of the Kirlian photography could be simple if you have the equipment necessary. However, interpreting the data, interpreting the patterns of the aura is a highly complex job, and it requires a highly seasoned expertise in the area. One professor, Edward Now, in Russia, did this particular study for us out of his own curiosity. He was a highly qualified parapsychologist, and he invested a huge amount of research and time on the study of the human aura and correlating with the human health and the psychological status of the individual based on the aura. So this is the kind of work he was doing, and when he understood, he came to know about the concept of Rasayana and its effect on the stress. He thought it would be interesting to do a study on this matter. Actually, if you look at the aura, what happens is it is we all see in Hindu calendars or in pictures, we see a white radiation around the gods or the ancient rishis and sages. What actually does it mean? The white colorless aura shows a state of perfect health. What we call actually samadosha, samadnishcha, samadhatu malakriya, prasanna atma indriya mana. That is the definition of a perfect health as defined in the Ayurveda Charaka Samhita. So when you are in the perfect state of health, particularly with reference to the characters, the prasanna, atma and indriya, when these three are in perfect balance, the aura would be colorless and white. Almost every human being will emanate a kind of a colored aura, and the color patterns depict your health status. It shows your psychological status. For example, if you take my aura now, it will show highly what I call actually this pinkish whatever you are seeing, the pinkish aura indicates the levels of stress and anxiety, while the bluish aura shows some degree of tranquility. Now, this is the after 10 days of treatment of a Rasayana product called Shilajit, the asphaltum, and then after 15 days of treatment, you see the intensity of the pink aura has reduced and the blue aura improved, and that is what Professor Edward Namu interprets, that actually the therapy in 15 days of therapy with Shilajit reduced the levels of stress in the individuals. This is the picture of this is the picture of the aura with thumb. Actually, the thumb was placed on the camera and the aura was captured in this particular picture. Like this, he did this study on 30 patients. And how does he interpret the outcomes? It is almost he was having a 2,000 studies aura he has studied and correlated with their psychological and mental status at that point of time. And then on that basis, this interpretation was provided to us. We all know actually the smoking is considered to be the worst form of polluting the human body. You know, it causes one of the important negative effect of smoking is the damage to the chromosomes which are the clastrogenic effect. In this particular study, Chyawanprash was administered in smokers' population, and its effect was studied on the mitotic index, satellite associations, and the frequency of the chromosomal aberrations and the system chromatic changes. There are three. In this, you find that the first bar shows the normal individual who are not smokers, that is the chromosomal status. And the red one is the pure smokers before the treatment. And the second bar, the third bar shows the effect of Chyawanprash on the chromosomal damage. You see in almost all the parameters, the Chyawanprash administration has shown that the chromosomal damage has been controlled effectively, and the outcome has been statistically significant. Now, other aspect is in the cancers. Radiation is one of the commonest approach today, and then radiation has its own degree of effect on the body. And this is a study again on using Chyawanprash in radiation-induced skin disease. Actually, the pictures are reversed over here. The second picture shows the soon after the radiation. And then this is the after the radiation treatment, the Rasayana treatment. And then in the second case, it is Rasayana with vitamins and iron. And finally, in the third group, we find only the vitamins and iron. As you see, the level of injury, radiation injury, Chyawanprash treated or Chyawanprash with vitamin treated, the radiation lesions have been substantially lower. However, the one important aspect is in this kind of studies we can't go for a placebo-controlled studies because of the severity. This particular effect shows that Chyawanprash exhibits a marked cytoprotective effect on the human body. The next case I would like to narrate to you is the administration of ashwagandha in ashwagandha extract on the generalized anxiety disorder. The study was done by Professor Marsha Ramani. In this particular study, the two groups of patients were administered. One group received the ashwagandha extract capsules. The other one received the placebo, a equally matching placebo. And they have used three different criteria. The diagnostic and the APA, American Psychology Association's criteria for assessment of the anxiety disorders, and the Hamilton Anxiety Score, and the PGA score of the well-being. In all the three accounts, we find that ashwagandha exhibited a marked improvement post-treatment, and that is that surpasses the effect of the placebo. These studies indicate to you, these studies bring out a fact that Rasayana administration of the herbs or the formulations designated or identified as a Rasayana have a promotive effect on the health. They improve they improve the well-being for all the well-being factors, whether it is during the radiation injury or during a stress condition. So this is the advantage of that. Now, if you look at that, these are only four. It's only tip of the iceberg I have shown to you. There are over 1,000 papers on the biological activities of the Rasayana. The concept of Rasayana attracted the attention of the health researchers way back in early 60s, mid-60s onwards. There have been a number of scientific studies to establish the biological activities of the Rasayana. And these reports can be classified into various groups. The adaptogenic means actually it allows the administration and allows the individuals to adapt to a newer situation, adapt to the impact of the stress and the stress. These are called the adaptogenic effect. And the nootropic effect is actually the effect of the central nervous system and the psychological parameters. This is Mecha effect we call in Sanskrit. Antioxidant and Rasayana drugs are now established to promote they modulate the immune systems. Modulation of the immune system means when the immunity is lower, it will improve and improve the resistance to improves the resistance to the infection. On the contrary, when the immune system is working aggressively, causing to the autoimmune disorders, then it has a positive effect by reducing the level of by tone down the immunity functions and make it more intelligent, and then anti-stress and the anabolic effect. These are the 6 effects that have been widely demonstrated. And of course, now I come to the. So now the concept of Rasayana in a nutshell. Basically, Ayurveda does not require any introduction over here. The Rasayana actually is Ayurveda has a two specific mandate. The first mandate being the preventive health care. Preventive promotion of the health is the first mandate set itself on the Ayurveda. And Rasayana, it aims at the promotive health and quality life. And there are 3 different modalities of Rasayana treatment. The dietary modalities, behavioral and drug-based modalities. That is what I have described of the drug-based modalities. And we both Ahara and the Dravya Rasayanas, they have immense potential for innovations in the nutraceutical sector. So this is the basic concept of Rasayana as described in the Charaka Samhita. Dirghamayu, Smruti, Medha, Arogya, Karuna, Vayaha, Prabhavarnam, Swarodaryam, Dehendriya, Palam Param. Vaksiddhim, Pranatim, Kanti, Labhatena, Rasayana. These are the benefits of the Rasayana treatment. And the mechanism. The mechanism, Labhopayam, Hi, Shastana, Rasayana. The one, any kind of intervention which will improve the circulation, which will improve the quality of the nutrition or the rasa part of it. And then that is called Rasayana treatment. So whenever the rasa formation is the first part of the metabolism, cellular metabolism, and once that is done, the rasa circulation is ensured, then these two, rasa formation and rasa circulation, these two factors hold the secret of the positive health. This is what actually Ayurveda aims at. And the benefits of Rasayana, they promote longevity, memory, as described in the Ayurvedic literature. It promotes longevity, memory, intellect, youthfulness, etc., etc. And the mechanism is a simple intervention in the cellular nutrition. Rasayana drugs make an intervention to the cellular nutrition. That is the fundamental underlying mechanism. And actually, what is the nutritional and intervention? Anna is the food that we take. Anna is the diet we consume. And once if it gets digested, the essence of coming out of that, the nutrient emanating out of the macro level digestive system is what actually the Anna. And that Anna goes to the individual cells and promotes the cellular nutrition. That is the part of that. That is the second most important part of it. Anna is common. The digestive fluid, but the nutrients that go to respective tissues, they are tissue-specific nutrients, have to go, and this is what exactly Rasayana treatment does. So this is the I finish just 2-3 minutes. So this nutritional intervention is a continuous process. It is incidental as well as the intentional. What is incidental? For example, it has a tremendous emotional factor. When your mom cooks something for you, she has a very clean intention that this food nourishes the kid. So that is the emotional factor of the food. That emotional factor itself produces a high quality of Rasayana. So therefore, that is how we consider home food is more healthier than outside buffets. So this intervention, as I mentioned, Anna, the ahara is the food per se that we consume, and the parinama bhava is the composition and the processing. In this parinama bhava, only what the kind of spices that you have, the way that you cook it makes intervenes the quality of the rasa that is produced in the human body, and the quality of the agni available in the individual, the jatanagni or dhamagni, and then Rasayana is the one which can intervene in any of these three factors. Rasayana is a component which can intervene in any of these three components. So, and there are unique applications of Rasayana as described in the Ayurvedic literature. One we call actually purposive and promotive Rasayanas. The other is the naimittika Rasayanas. For example, the Vayasthavana, anti-aging, or the nature Rasayana, future Rasayana. These are sometimes the naimittika Rasayana is the biological response modifier of the cytoprotective agents which I have narrated in the cancer research part of it. So these are the illustrative list of these species. In the Nightantus you find different sets of terminology. Rasayana is a general health tonic. Major Rasayana is the one which promotes your intellect part of it, the nootropic or intellect part of it. Vayasthavana, anti-aging, these are the different plants based upon the negative descriptions. Rasayana, nature, Rasayana and Vayasthavana, this is the combinations of them. And there are some organ-specific, Ruja Rasayana. Consumption of Arjuna improves your cardio, acts as a cardio tonic, and it helps as a heart health part. Tvacha, Mandishta, and Rubia carnifolia, and I prefer like Stanya is actually for lactating mothers. The Jivanti is considered to be an important galactobacter. Now in the present case, now I come to the conclusions. What is the importance, or what would be the importance of Rasayana? For that purpose, we need to understand the present healthcare scenario. The infections and infant mortality have come down substantially with thanks to modern healthcare approaches. And the lifestyle-related diseases, unfortunately, is going up. Autoimmune diseases are also going up. And another part is the iatrogenic problems, like the way radiation therapy. I told you, these are the iatrogenic diseases are the diseases induced by the doctors and induced by the medical treatments. So then the nutritional conditions we find diametrically opposite scenarios. There is malnutrition and also there is a overnutrition. Yeah. Now this is last. Now I finally would like to touch upon the Mecha, Rasayana and the cellular intellect. In this particular part, as I mentioned, In Ayurveda, we consider volitional transecration. The intellectual mistake is one of the important factors for the disease. We know overeating is a problem, overeating is not good, but we continue to overeat. This is an intellectual or volitional mistake. The same kind of mistake would happen. This is at a gross level. But at the cellular level also, volitional transecrations may take place. The example is, the cell fails to discriminate between a friend and foe. So therefore it goes to autoimmune disorders. So it forgets the optimal multiplication needs. When the cell forgets the multiplication rate, it becomes a malignant and causes the cancer. And sometimes it fails to recognize the foreign proteins. Therefore, you are prone to infections. These are all the mistakes that happen at the volitional transecration at cellular level. But the question today is whether the major rasayanas can promote the cellular intellect. This is a question mark. And these are my conclusions and suggestions. The nutritional effect, I don't have to explain all those things. What I would like to suggest upon is concept of Rasayana provides broader avenues for the innovations, the formulations for the immunity care, specialty nutrition and performance enhancers like sportsmen and athletes, and also we can design disease-specific nutraceuticals for quality of life in malignancies, renal diseases, organ transplants. These are the opportunities that we have out of the concept of Rasayana. And thank you very much. Let me share with you. I knew the institution CBT for only a few months, and somehow or other, Shastriji reposed a lot of faith in me, and he encouraged me to dig out into my past experience. As I said, these are the works I started doing sometime in 2001. So he encouraged me to dig back into that and share these experiences. And I thank you for your patience for that.
Thank you, Dr. M.V. Brindavanam, for your insightful speech. I would like to ask Session Chair Dr. Kavya Dashwara Garu to present memento, shawl and certificate to our speaker.
To stay informed about the startup ecosystem, subscribe to my Startup TV.